I am so excited to announce my newest baby, a book for parents all about tongue tie. Tongue Tie for Parents is the book you need if you have any questions about whether there's a tongue tie, how to get treatment, if your baby needs treatment, how to go about it, how to make decisions, how to help you and your baby recover. All of that is in this ebook. Every day I get questions from parents like you, and I know you need answers. Tongue Tie for Parents is built from the same step-by-step protocol I use when families sit across from me in my office. It's the information that you need for clarity, for confidence, and to help you make care decisions based on your own goals, because that's what's most important. You shouldn't need a Google search to get answers. You aren't crazy or overreacting. You are trying to figure out what is best for you and your baby. It's here and ready for you. Tongue Tie for Parents is an easy download. You can have it today for only $27. Go to tonguetieexperts.net/parentbook or follow the link in the show notes, because you and your baby deserve clarity, not confusion. You're listening to the Tongue Tie Experts podcast, a weekly program providing information and support for those families impacted by tongue and lip tie and the professionals caring for them. I'm Lisa Paladino, a midwife and a lactation consultant with over 30 years of experience. If you are a parent looking for answers or a professional who is curious to learn more than what you learned in school on this topic, welcome. This podcast is for you. Hi, everyone, and welcome to the Tongue Tie Experts podcast. I'm Lisa, and today we are live on Facebook, and I'm recording it. So if you hear me talking to the Instagram, oh my goodness. If you hear me chatting with the Instagram audience, that's why, because I am recording a live on Instagram where I want to chat today. No script, just telling you about two scenarios that I had, two patient scenarios that I thought were good learning opportunities. You know, I love to give case studies, and a lot of times we have case study presentations in Latch and Lead in our professional membership. And I think it's important to look at certain cases and what comes up in real life practice. And also, if you're listening live or you're listening recorded and you want to let me know if these are things you hear, let me know. Let me know if these sound familiar to you. And know that my goal here is education, not judgment, and getting the word out there so that more breastfeeding families and even bottle feeding families get the help that they deserve and the support that they need to meet their goals, right? So I had a patient, and let's just call her Marianne, okay? And Marianne came to me saying, because I'm changing a lot of details so this patient does not recognize herself and so that nobody recognizes the story, but it's a typical story. So this, and I can just imagine you're going to be wherever you are listening saying, oh yeah, I've heard that one. That's the kind of story this was. But just in case, you know, you haven't heard this story or you don't know what to do with this story, we're going to go into that today. So Marianne came to me because she was having so much pain with breastfeeding. And if you know me at all, you know that I've written a book called It Shouldn't Hurt to Nurse Your Baby. And I really feel that way, right? We should sometimes expect to have some soreness, some tenderness, maybe a little pinchiness. It's a new experience. It's nothing we've ever done before, right? Or, you know, whatever. We've never nursed this baby before. So it's a little uncomfortable sometimes, but it should never hurt, and it should never continue to hurt. So this baby was a few weeks old already, And she went to her pediatrician, and the pediatrician, very good doctor. She likes him a lot. She feels very comfortable with this pediatrician in all the other things and all the other support she's gotten so far in these first few weeks. But she said, I think the baby's having trouble latching, and I think she has maybe having a tongue tie. And the pediatrician examined the baby and said, well, you know what? I do see a slight tongue tie. And I have no idea what the exam was, right? Because I wasn't there, and this is all hearsay. But she said it was a slight tongue tie, and it's nothing to be concerned about. Let's see if you can guess why. Because the baby was gaining plenty of weight. So because this baby had not lost weight and was gaining as expected, the pediatrician thought there was no problem with feeding. Even though mom was saying, the baby is hurting me. The baby has a difficulty latching and trouble staying on. She pops on and off. And there's a clicking noise. And I believe there's some reflux too. The doctor said, well, she's getting enough to gain weight. It's all fine. So, anybody have any ideas about this scenario? Anybody hear this scenario before? Of course, we did a complete assessment, and I'm not going to go into the complete assessment here. I just want to say, this idea that everything's fine as long as the baby's gaining weight is not exactly the real story. Mama's experience matters. And just because the baby can get enough milk doesn't mean that the baby is comfortable or nursing efficiently or easily, right? So, and then the other thing is, on her intake form, when I asked how many times the baby was nursing per day, the answer was, when we figured it out and counted it up, an average of 14 to 15 feedings a day. So what do we expect? We expect about 8 to 12 feedings in 24 hours. And this poor mama was nursing 14 to 15 times a day. And this poor baby had to keep trying to get back on and trying and working so hard to get the milk that she was getting. So the people listening on Instagram are saying that they've heard this before, and somebody else is saying it's literally the exact story as me. And this happens a lot. So what do I do differently, right? And what does anyone who's trained in the protocols that I teach, what do we do? First of all, we take a full assessment. We don't want to automatically say it's a tongue tie, but we do want to say this breastfeeding needs assessing. We need to see what's going on here. What's the root cause of this baby having difficulty latching, causing pain for mama, having some clicking, having to feed so often just to get what they need to keep their weight going, right? Their weight increasing as expected on the curve. How hard is this poor baby working? And how long are they going to be able to compensate? Have you heard the term compensate, right? So babies are wonderful at compensating. They want to stay alive. They want to thrive. They need to eat. So they will do whatever they can to get that food. And sometimes it's causing mama pain. A lot of times it's feeding very often, but it's a lot of work, and it's really not fair. Mamas and babies deserve to have more support than this. So again, back to what do I do? First, the full assessment. So I find all about, and I'm not going to share the details here because lots of details, but it was not an easy birth. This is mama's first baby, and she's a later in life baby. She also had a couple of other medical reasons why she might not have enough milk, right? So there were some risk factors there, which I'm not going to reveal here because I don't want anybody saying, oh, that sounds like me. But she had a couple of risk factors that made me want to keep an eye out to make sure that her milk supply stayed up. And typically when a baby is compensating with oral restrictions or anything else, the milk supply will be enough to keep up the baby's weight for a bit, and then it drops off. So we want to be really careful with that. And I told Mama to be very, very aware. And even if I never saw her again, to make sure that she has the anticipatory guidance that something can happen down the line. Just keep an eye on her weight gain and her milk supply. So we do the flip tool. And if you've ever heard of the flip tool or not, it's Dr. Rajiv Agarwal, who's a pediatrician in Arizona, developed this tool and had it verified. It's appropriate to use in research. That's how strongly verified this tool is. And it's for breastfeeding success. And without going too much into it, I teach all of that in Professional's Guide to Tongue Tie. It's all there, and the link is there and everything. But the flip score, there's two different scores. One is about the latch and one is the overall score. And both of the scores were extremely elevated, meaning that we had to, if we did not intervene. Moms, you know those mornings when you wake up groggy, your mouth is dry, and you feel like you didn't sleep at all? A lot of that comes from mouth breathing, not just a long day with the kids. That's where OI tape can make a huge difference. It's a gentle, medical-grade mouth tape that helps you breathe through your nose while you sleep. It might sound a little unusual, but the results can be seriously life-changing. Deeper rest, more energy, and even less morning puffiness. And for parents especially, good sleep isn't a luxury, it's survival. What I love about OI tape is that it's hypoallergenic, toxin-free, made in the US, and comfortable enough for all-night wear. As a listener to this episode, you can save 20% on all OI products with coupon code TONGUETIE20. So if you're ready to breathe better and actually wake up rested, head over to oitape.com today. In some way, then this breastfeeding relationship probably was not going to last. So the latch score this is all about breastfeeding, not necessarily tongue tie. It's not a direct tongue tie assessment, but it makes you look and see what else is going on. And maybe it's a tongue tie because all the symptoms are listed out there that correlate with tongue tie. So what did we do for her? So first of all, I always look at how baby is nursing, and we suggested some easier holds for Mama to get the baby a deeper latch for now. And that's what we did. And then I start where I always start with the teamwork. Now here we're going on the fact, as I always say, for the most part, tongue tie release is not an emergency. And there was no emergency here. Baby was feeding, baby was gaining and is healthy. And Mama is able now to get a latch that doesn't hurt too much. So is it urgent? Is it something we have to look at like right away? Absolutely. Is it an emergency? No, not an emergency. So we are going to take our time, learn all about it. So, of course, Marianne got a copy of my Tongue Tie for Parents book, which the link is available in the show notes, and the Parents Guide to Tongue Tie, which goes through all my protocols for parents, you know, what to do first, how to find a provider, all the things. And Marianne was not local to me, so we had to do some searching to find good providers. But my suggestion to her was, because she also said baby had some tightness in her neck and baby had a difficult delivery, so let's find a good body worker. Whatever is close to her and she can afford, a CST provider, a chiropractor, an OT, a PT, whatever is available and acceptable for this family. She has a list now of people to choose from, and we'll do that first. And that's where we left off. And then in the meantime, we were looking for release providers in her area so that if she decides that she will go that route and she'll have a path to go. Now, maybe this baby just needs some body work, right? I don't know for sure yet because we don't know what will happen, right? And we don't know if we can make all these symptoms get better and if we can get baby latching better if she has release of some of the tension. So we always do that first, especially if everything is stable or as stable as can be. And when I say it's not an emergency, I don't mean that we should wait forever. I mean, she should get on it right away. But, we're not making an appointment for release tomorrow. That's what I mean by that. Okay, so that was Marianne, and that was that case. What do you think? I could imagine that a lot of the lactation consultants in the audience can relate to hearing this story. And then there's another story that I have, and I'm going to call this one Bethany, and I'm going to name her Bethany after my old office assistant. Old meaning not that Bethany is old. Sorry, Bethany, if you're listening. My office assistant when I worked in office in my old practice, Bethany. So this is Bethany, and Bethany came to me at 6. The baby was 6 weeks old, and Bethany had a tongue tie release at 2 weeks of age, and she had seen a lactation consultant. And the only thing the lactation consultant told her, this is what she told me, was that the baby had a bad tongue tie and it needed to be released. And so Bethany brought her baby for a tongue tie release without any pre-care, no exercises, no making sure that's all that was the problem, no preparation for the day, no pain relief, nothing. None of the protocols that I teach were followed. And what Bethany told me was the day of the release was a really scary day for her. And baby cried a lot, and she didn't latch, and now she's having trouble latching a lot, almost always. So she started pumping, and she's triple feeding, which for those who don't know, first of all, triple feeding is something I never recommend for more than a couple of days. It means you are both trying to nurse at the breast plus pumping and bottle feeding at every feeding. So she was triple feeding in order to keep her milk supply up, to keep the baby knowing how to latch, and to teach the baby to latch. But she was also supplementing with formula. So this was a whole, as I'll keep it G-rated. It was a poop show. Let's just say that. She still had nipple pain. The pain was a little bit better in the first couple of latches after the release. But after that, the nipple pain returned. She's had mastitis multiple times. And now she messaged me the day before our visit. She said, you know what? I had been doing the triple feeding, but now I can't even get her to latch at all. So we had we had a live visit. It was actually a virtual visit. And in order to get the baby latched, she happened to have nipple shields on hand. So we tried out. She had 2 different sizes of nipple shields, and we got the baby to latch with a nipple shield. And the baby was showing me signs that she was sucking and swallowing and getting something. And mom felt relief afterwards. So she had a feeding with the shield that was comfortable. I directed her, and it's kind of an art to direct someone virtually to latch the baby. But I have a baby doll model, and we do all this, and we get it right. So we got her to a comfortable latch, and she had a feeding, but we knew that something else had to be done here. So frustration here is the sending off for release without any preparation. So there's 3 tenets that I like to think about. We want to, first of all, make sure that there is a tongue tie, right? Maybe there was or wasn't a tongue tie that was released. I will give them the benefit of the doubt and say they saw a restrictive frenum. We want to make sure it's that tongue tie that's causing the problem, right? Because sometimes it's something else. And then the third thing is we want to make sure that there is nothing else that needs to be corrected before we send to tongue tie release. And once we're sure of all those three things, we want to make sure that mama and baby and the whole family is prepared, right? Prepared with what to expect, that they're choosing the right providers, that maybe they needed body work before and they got that, or have the body work set up for after. They have discussed pain relief. They know what they can do if baby won't latch that evening after the release, all the things, having the exercises, practicing the exercises, doing some exercises in the mouth before the procedure. So many of these things that I outline in both my parents' courses in the book and Professional's Guide to Tongue Tie. I teach professionals how to do this with their families. So none of that was done with poor Bethany and her baby. And now they're still fighting an uphill battle. Things are getting better. What did I suggest for her? I suggested that Bethany go and, find a body worker. We did the same thing as I did for the first patient that I discussed, and found her local people in her area to go to. And there were some exercises I showed her to do, etc. And hopefully things will be getting better for her and for both of these women who are trying so hard to feed their babies, right? And if you hear yourself in these stories, my heart goes out to you, whether you're a professional or especially if you're a parent. Know that the reason that I am here doing this work is so that less people have these experiences of less than optimal care, because our mamas and babies deserve the best care, and they deserve educated providers to give them that care. So here I am. If you are a parent and you're looking for resources, in my bio is the link to Parents Guide. Tongue Tie for Parents is the book. It's fantastic. It's a pretty book. It's got nice pictures, and it's very easy to follow, and it's short, and it's a download. You could start it today. And it's only $27. And then for professionals, this week only, my half-price gratitude sale, because from the bottom of my heart, I am wishing all of you great thank you for all you do, for all you are, and keep doing the good work. Okay? And reach out. You can always find me on Instagram at Tongue Tie Experts, or you can send me an email, lisa@lisapaladino.net, or on Facebook too, less and less lately. Our portal for the professional course is finally off of Facebook, which I love because I like giving less and less attention to those forms of social media, if possible. Anyway, so thanks for being here. Thanks for listening today. If you're listening to the podcast, and if you are on Instagram, thank you for following me. Please follow me. Send me any questions in your DMs, and we will talk soon. Thank you so much for listening to this week's episode of the Tongue Tie Experts podcast. Check out the show notes for useful links about the topics we discussed and for ways to follow us on social media. Please subscribe to us on your favorite podcast app. And if you enjoyed listening, we'd love it if you'd rate, review, and share with your friends and colleagues. Thanks so much. Bye-bye. Are you a healthcare professional working with breastfeeding infants? Wish you knew more about assessing and treating tongue ties? Earn continuing education credits and transform your practice with the Professional's Guide to Tongue Tie in the Breastfeeding Infant. It's perfect for any practitioner who works with infants and their mothers, especially those working through feeding challenges. Learn to identify who needs treatment, build a qualified care team, and provide holistic care options. Discover the ins and outs of frenotomy, including procedure preparation and best aftercare practices. By the end, you'll be confidently supporting breastfeeding families armed with the latest protocols, and be part of an interdisciplinary community of experts just like you. Tongue ties are nothing new, but the right way to assess and treat them is. Ready to make a real difference? Join now and become a tongue tie expert. Sign up today at tonguetieexperts.net/professional and become the evidence-based resource that your community needs. To show my gratitude, I'm offering you a special discount as a podcast listener. Use code PODCAST40 to save 40% off today.